This is the advanced training on microsurgery. This training will cover the end-to-side anastomosis between the common iliac arteries. In the microsurgery anastomosis training, you will use the femoral artery, femoral vein, and the common iliac arteries. In this training on the end-to-side anastomosis, you will use both of the common iliac arteries. We will start with the incision. If it's difficult to start with naked eyes, start with a low magnification under the microscope. Draw a cut line on the abdomen and make an incision using the Adson's forceps and iris scissors in the middle of the abdomen. Incise through the abdomen skin, subcutaneous skin, and muscles. Use a hook on each side to secure a clear view. Move all of the intestines to the left side of the animal to find the caudal vena cava. You will also be able to find the aorta parallel to the caudal vena cava. Both of the vessels progress to the lower body and divide into two branches, which are the common iliac arteries and veins. It is easier to perform an anastomosis if you turn the animal around 90 degrees due to the direction of the common iliac arteries. Start dissecting the vessels using the jeweler's forceps and dissecting scissors. Try to not directly hold the vessels, but hold the surrounding tissues while dissecting to avoid damaging the common iliac arteries. Remove the soft tissues around both of the arteries. Once the recipient vessel, which is one of the common iliac arteries, is dissected, place a double clamp on the artery. Ligate the distal end of the donor vessel, which is the other common iliac artery, and place a single clamp on the farmost proximal side. Cut the vessel with the adventitious scissors near the ligated side. Then wash out the blood in the vessel, remove the adventitia, and dilate the end of the vessel twice as much using a vessel dilator. Make an arteriotomy on the vessel in between the double clamp using the adventitious scissors. To do this, lift the vessel by either using the jeweler's forceps or by making a suture, and then make an arteriotomy using the adventitious scissors. Pay attention to make a clean cut. Drain out the blood, remove the adventitia, separate out the surrounding tissues after placing a background material, and check for any leakages before starting the anastomosis. There are two ways to perform the end-to-side anastomosis. One is the back wall first technique, and the other is the near side first technique. When you use the back wall first technique, you should suture the back side of the vessel first. You should perform the first suture at the 9 o'clock point of the recipient arteriotomy and keep suturing clockwise at equal distances. For the near side first technique, suture at the 9 o'clock and 3 o'clock points first, suture the front side, and then the back side at equal distances. You should remember that the direction of the suture is radial around the arteriotomy instead of transverse like the end-to-end anastomosis. This shows how to suture using the back wall first technique. Once the suturing is complete, perform an interrupted suture in the direction of the first suture to complete the suturing process. Then check all the sutures before making the last stitch to perform a successful anastomosis. Remember to keep washing the vessel to prevent it from drying out. This video shows the near side first technique. Suture at the 9 o'clock and 3 o'clock points. Suture the front side at equal distances, and then the back side to complete the anastomosis. This is the end of the anastomosis. When the anastomosis is complete, check if there are any leakages to decide for the success of the anastomosis. Use the jeweler's forceps to block the proximal side in the recipient and donor vessels and examine the pulses of the blood going to the distal side. This is the end of the training on the end-to-side anastomosis between the common iliac arteries. Thank you.